Hi, this is Dr. Karen Becker. Recently I had a great opportunity to interview Dr. Richard Pitcairn about homeopathy. Dr. Pitcairn graduated from the University of California, Davis in 1965. Since then, he's been on the faculty at Washington State University. He got a PhD in microbiology, and he was actively involved in veterinary immunology research and teaching. During his research on the factors affecting natural disease resistance, the importance of optimal nutrition became a focus of his work. Realizing that such research would not be funded, he re-entered private practice to apply his study of nutrition and its effects on immunity and resistance to disease. In addition to nutrition, in 1978, Dr. Pitcairn began focusing on learning and applying homeopathy as a natural system of medicine that stimulates the immune system and natural resistance to disease. In 1982, he and his wife, Susan, published the first edition of Dr. Pitcairn's Complete Guide to Natural Health for Dogs and Cats, which is now in its third edition and has sold over 400,000 copies. In fact, when I began home preparing meals for my dog during vet school, it was his book that I used as my first recipe guide. In 1992, Dr. Pitcairn established the Professional Course in Veterinary Homeopathy, a year-long postgraduate training course for veterinarians, and this is where I first met Dr. Pitcairn when I took the course in 1996. In 1995, he and his associates co-founded the Academy of Veterinary Homeopathy, the first professional organization of practicing veterinary homeopaths in the U.S. Since then, he stayed very busy creating a veterinary repertory of homeopathy with Dr. Wendy Jensen and continues to teach and write about veterinary homeopathy. I've asked Dr. Pitcairn to join me as a part of our lecture series on the Highlighting the Healer series, which focuses on highlighting how holistic veterinarians are using natural modalities to help unlock the body's healing potential. Because Dr. Pitcairn is considered by some of us to be the father of veterinary homeopathy, I invited him to share with us more about this really unique form of medicine. Okay, Dr. Pitcairn, for all those people who are confused about what homeopathy is, would you take a few minutes and explain to our listeners and readers what exactly is homeopathy?
Well, that's a big topic, isn't it?
It is.
Let's see if I can give you the simple explanation. Homeopathy started with a discovery that a doctor made about 200 years ago in Germany. And that doctor was investigating, he was trying to understand how medicines could act to make people better. Not an unusual ambition. And so he was exploring the action of different medicines of his time. And he had the idea, which is still somewhat of an unusual idea, that is to test the medicines in healthy people to see what effects they had. You know, most of the research that's done today is done in sick people, where drugs are given to see what effects they have. He thought of doing it in healthy because there was quite a bit of confusion about what the actions of the different substances were at that time. When you give them to sick individuals, then you get a mixture of side effects as well as hopefully therapeutic effects. So when he did these studies, he made an observation that it appeared that when medicines caused symptoms in healthy people that were very similar to the symptoms that the sick people had, that those medicines seemed to somehow be beneficial when they were given to the sick. I don't know if that's obvious or not. He had the idea that the medicine somehow acted as a stimulant when it was given in that way. In other words, the usual way we think of giving medicines is that we give a drug, say your dog has diarrhea, so we use a drug that stops the intestines from moving so fast. He found that if the medicines that were given had already been determined to cause symptoms similar to the patient's condition, it acted differently. It acted as a way to stimulate their healing process in some way. He didn't fully understand it at first, but he began to apply that as a method. And that was the beginning of homeopathy.
And he went on, Dr. Samuel Hahnemann went on to do provings.
Well, that's what he called, that's the term. It actually, he didn't call it provings. The German word proofing means to test. So the word he used was he was testing medicines in healthy people to see what they did first before he applied them to the sick. And it's been translated in English as provings.
And so the testings that he did, I think...
I mentioned that to you because it's sometimes people object to it. They say it's not scientific proof.
Yes, sure.
That's not the way we mean the word, proving.
So I think that where some of the confusion about homeopathy comes in is also in this concept of dilutions. Talk to us a little bit about why such tiny amount of substances are offered and what these dilutions mean and how they act on a body's healing forces.
Yeah, it's interesting. Now, mind you that what I just described as Dr. Hahnemann's original discovery was the beginning of a career for him that lasted 50 years or more. So he learned things gradually. It wasn't like all of a sudden this fell into his lap, you see.
Sure.
So one of the things he found after he started to apply this idea, that is, I'm presented with a sick person, I know this medicine from testing it before will produce symptoms very similar to what they have now. I'm going to give this medicine to them as a way of treatment. Now, as he did that over time, he found they were often very extraordinarily sensitive to the medicine. In other words, they were affected more strongly than you would expect by it. Mm-hmm. So that was another discovery. And as a result of that, he began to give less of the medicine. Mm-hmm. He thought, well, the dose is too big.
Right.
So I'm going to dilute it down. I'm going to give less of it. So he went from giving a teaspoon, say, to a drop. And then for some patients, a drop was too much. So then he started to dilute it. And he diluted, 1 to 100 or something like that and try that. And that worked all right in some. And then in others, that was too much. So he diluted it some more. And so it evolved into the method that we are familiar with today, where the medicines are very much diluted and given in small doses.
And so when people hear that the more diluted the medicine is, the more powerful it becomes, they're confused about why such a tiny amount of a substance could have such profound effects on an animal or a person's healing response. And how do you help people understand how those dilute substances can affect a body's immune system response? How do you help? Because especially in our country where we're always supersizing and we take more and we're over-prescribing huge amounts of drugs, this whole concept of minimum dose or dilutions that sometimes are diluted to the point that it's just an energetic frequency, people are confused about that, unless you study quantum physics, which you do. And so maybe you could speak to that effect.
Yes, it's a big topic. There's really two parts to it. One is the question that you raised about from the homeopathic understanding, from experience of Hahnemann's in 200 years, how do we understand the Medicines Act? That's one thing. Then we could also, I don't know that we have time for it, but we could bring in the more modern discoveries of quantum physics which would support these ideas. So let's go back and start with what Hahnemann found. Carrying on really from what I just described to you, as he used smaller and smaller amounts, it's obvious that after a while, after a number of these dilutions, and I want to emphasize to you, it's not simply dilution, but he found that what was necessary was to very strongly agitate the liquid between each step, shake it up vigorously, or they would have it in a flask. They would hit against their hand or against a pillow or something to agitate the liquid. And there have been, as a digression, I will say there have been studies done where they've diluted medicines and then they've gone through this process I just described where there's dilution and then the agitation each step of the way. Does that make sense?
Yep.
When they've done those studies, they find that diluted medicines have no observable effect.
Interesting.
But when they're energized, as I described, they do have an effect. Mm-hmm. So going back to what Hahnemann found, he said that in the process of making these dilutions like this more and more, because the patients were reacting excessively to the medicines, it got to the point where he said, more or less, I'm putting his words into this, he said more or less that there can't be any physical substance left anymore. So it must not be a physical substance that's having this effect. It must be something more like an energy of some sort. Mm-hmm. And he talked about it at his time, 200 years ago. He compared it to magnetism, mm-hmm. because he didn't know about quantum physics
Sure.
and other things like that.
Sure.
You see? So he said maybe it's like a magnetic effect where the magnet affects the iron filings near it. He said maybe it's something like that. But in any case, what he found was that it wasn't really a physical action, but more of an energy effect. Now, I'll add to that, which might help a little bit to understand the model. One of the ideas that emerged out of homeopathy, which isn't really different than many other systems of medicine in the world, is that there's an energy that's responsible for life. And in homeopathy, it was called the life force, or the vital force. In Chinese medicine, it's called qi. Mm-hmm. In chiropractic, it's called the intelligence or something, I forget. So there are many systems that have recognized that there is such a thing as an energy field, if you will, or an energy informational impulse that's behind the formation of living beings, whether it be plant, animal, or human being. So the idea is that when you go through this process of dilution and agitating of the fluid, you release that energy from its physical organization. You release it into a form that's more effective, mm-hmm. that's more potent. And that's why they call home remedies potencies.
And so for people that say, you may have lost me on that, it kind of sounds like this is new agey, talking about energy, rearranging energy. This is, of course, a very old form of unlocking a body's healing potential. But when people say to you, I'm nervous about this being a form of new age medicine, what's your response?
Well, there is confusion about this because the New Age movement embraced a lot of different forms of medicine other than the allopathic, and that includes homeopathy. And people sometimes think that it's a new system that came out of this. But it really isn't, as we've been talking about. It's over 200 years old, and it was a system of medicine that evolved outside of the more recent paradigm of New Age spiritual thinking. Mm-hmm. So, as far as on a practical level, when clients would come to me with their animals, we didn't really go into this so much. I would say, I think that this treatment will help your animal, and they said, okay, fine. I didn't go into a lot of explanation about it.
Right.
Here are the medicines to give, and here are the instructions. And there might have to be some explanation as we go along about how the medicine effect will result in certain changes. Mm-hmm. But I found that usually going into the theory with clients wasn't particularly helpful.
Sure. Well, in fact, you have a funny story that at least in 1996 you told to our class about your particular introduction to homeopathy. And part of it was really amusing to me because not only were you trained professionally with your PhD, you have a strong background in research and clinical applications. You're a critical thinker, and I think initially you had a lot of reservations and questions about homeopathy. So you told us in class, I don't even know if you still tell this story, you told us in class about how you decided to try a remedy and just see what would happen to your body. Do you remember telling us this story?
Well, I'm thinking it probably was the first time I went for treatment to a practitioner.
Yes.
Yeah.
Yes.
Well, I didn't know very much about it. I should say that the only reason, not the only reason, but let's say the impulse for me to be interested at all came out of my graduate work in immunology, because I had gone through 7 years of graduate work, and I had learned quite a bit, of course. Mm-hmm. But I also realized that the study of immunology that I had experienced didn't really tell me how to restore health mm-hmm. to my patients. It told me how things could go wrong,
yep.
but it didn't really help me to understand. So I was still looking for some kind of an answer. And when I read a book about homeopathy, it sort of triggered the thought, this really sounds like what I've studied to some degree. I mean, it's not the same. But it sounded similar in a way about stimulating the immune system, and I'd like to learn more about it. So I had the idea then that I should experience it myself. So I set up an appointment with a practitioner. I knew nothing about how it should be done, really. And I didn't know much about this practitioner. And this particular one, it turns out, as I learned, really wasn't the mainstream homeopath. He had his own methods of using a pendulum to find the remedy and so on. But he gave me this remedy to repeat, a high potency remedy. And I had such a strong reaction, I ended up in bed for about a week.
Yes.
I couldn't eat. I lost 15 pounds. I couldn't even watch TV. I was so sick.
Right. And
so I didn't get better, but I certainly was impressed.
Yeah, I was going to say, when you never questioned at that point whether it was, sugar pills that couldn't affect your vital force, you had clear experience firsthand that they were powerful medicines.
Yes, and it was what's called a high potency medicine. In other words, it was well beyond any physical substance. And I can assure you that I was not expecting to get sick like that.
Sure.
I was thinking that if anything, I'd feel better.
Yes, or maybe nothing at all.
Or nothing at all.
Right,
But
right.
certainly I didn't expect to get as sick as I did.
Sure.
So just to explain that a little more, I understand that wasn't really the best medicine for me.
Mm-hmm.
And that I shouldn't have taken it so many times as I did. This fellow had me taking it every 3 hours for 2 days.
Oh, goodness.
A high potency remedy.
Wow.
So it just made me sick.
Sure.
I had too much of it.
Sure. Let's talk a little bit about how veterinarians, integrative veterinarians, include homeopathy. And my goodness, there's classical homeopathy, but then there's all of these really different variations, Dr. Pitcairn, that have kind of been introduced that don't really follow classical homeopathy principles. Talk to me about if that's what Dr. Hahnemann had in mind, or how some of these different evolutions of different forms of homeopathy have come about in the last 200 years since Dr. Hahnemann originally did his investigations. In veterinary medicine now, a lot of people will come to me and say, I'm interested in homeopathic medicine, but they don't even know what that means. They're really interested in maybe holistic medicine, and homeopathy is a type of holistic medicine. But why don't you help clarify for our listeners and readers about this is one type of holistic medicine, but it's very, very different, and there's many different branches. Why don't you explain a little bit about that?
Sure.
That's a
it's
big
a big
question.
Topic too.
Yes.
Let me say this let me explain something first about it before we launch into that. Referring back to what I said earlier about how Dr. Hahnemann discovered medicines act, and that they act to stimulate the body's natural healing abilities. In other words, if you give a drug, as we usually think of drugs, they have a physical effect or a chemical effect on the body. They slow down the intestine, they stop the itching, if it's a steroid or whatever, because it acts on that level. The homeopathic remedies do not act like that kind of drug. They act on a different level, as I said, an energetic level. And what they do then is they harness, if you will, or stimulate the healing abilities that are in the body. Now, let me give you an example of the difference. Let's say a simple thing would be, let's say that you had an injury, say a cut in your arm. And of course, then as a result of the cut, it's going to get somewhat red and swollen and painful as part of the healing process. Mm-hmm. That your body will go through a healing, and as it goes through healing, it will go through different stages, form a scab, and so on, until it finally grows new skin. So that's the natural healing that has to occur, regardless of whatever method you use. Mm-hmm. There has to be a healing.
Yep.
The homeopathic method will enhance that process and make it happen faster and shorter. The conventional drug treatment will use drugs to counter that. So, for example, applying ice to stop the inflammation that's there, even though the inflammation is part of the healing. Mm-hmm. Using an anti-inflammatory drug, using a drug to stop any feeling of discomfort or pain, mm-hmm. which seems like a good thing. But what it's doing is it's interfering with the healing process of the body. Does that make sense, that contrast between the two?
It does.
All right, so now we go into practice. a veterinarian takes training in homeopathy, they may or may not understand the difference that we just talked about. So some veterinarians will be interested in homeopathy enough to really seriously study it, realize that it's a way of using medicines, and orient their practice that way. And they can have a practice where they offer homeopathy, maybe along with nutrition or chiropractic or something like that, but they're using homeopathy in the way we've discussed. It's also possible for a veterinarian not to either fully understand that or to accept the idea that that's the way it works.
Right.
And what they'll do then is they'll incorporate homeopathy in their practice, and they'll combine it with, say, the use of drugs or use of other measures that run counter to the homeopathic effect. So it's possible then that the animal could receive two treatments, one of which is stimulating healing, the other is trying to slow it down.
Sure. Sure.
So it is confusing to the public.
And confusing to the body as well.
It's confusing. Well, yeah, they don't get the same. They don't get the same. Well, they certainly don't get the homeopathic effect we're talking about. They may get better gradually because of all the things that are being done.
Sure.
But you're not really using homeopathy as it is intended. Now, when I say as intended, I mean to say more like it was developed originally, and it has been more understood over the last 200 years. Now, like any other set of ideas, there's all sorts of variations that have been proposed, and there are many other teachings out there about how to use. They would call it homeopathy, how to use it differently than I've just described to you. And so, as a kind of almost like a self-defense, homeopaths have said, well, what we're doing is classical homeopathy, meaning the homeopathy of the last 200 years, you see.
Original.
Based on those principles.
Right.
And then the other schools of thought have said, oh, we're the modern homeopathy, or we're this or that. And so it gets very confusing. And actually, I might mention that if anybody that's listening wants to have a better understanding of this in terms of working with an actual practitioner for their animal, I mean to say that they do want to have homeopathic treatment, if that's their orientation, not just holistic, but they actually want to have homeopathic as we're talking about. Then to determine whether the practitioner they're going to is going to offer that or not. You see, that confusion.
Yes.
There is on my website,
Good.
there is a page that has a number of questions you can ask the practitioner. So how do you determine whether that practitioner is going to actually offer you this homeopathy or not? So that's very helpful to people if they want to go read that.
Very helpful, and we'll put a link to your site, because it's confusing. There's a lot of different types of homeopathy now that can be very confusing to people, and it's important that if people are seeking original classical homeopathy that they know what they need to be looking for in a practitioner. So why, Dr. Pitcairn, why do you feel like homeopathy hasn't been widely accepted? In fact, even in the holistic community, there are some holistic practitioners that opt not to use homeopathy. Why do you think that is?
I think it's really it's a conflict at a metaphysical level. I mean that it's like there is an underlying belief system with any system of medicine, right?
Yes.
Whether it be Chinese medicine or chiropractic or homeopathy or whatever, there are certain ideas that underlie it. And if I can generalize, by that I mean if I can talk about the philosophy of medicine, because I know that individuals within medicine vary considerably, they're not all the same. But speaking generally, medicine that we know, that we call Western medicine, allopathic medicine, conventional medicine, as it is in the United States, is based on the idea that's very materialistic, that we are physical beings. Now I'm talking about the system itself as a philosophy, that we're not really spiritual beings, we're not energetic beings, we're physical beings. And that medicine should be directed towards treating that physical level. When homeopathy comes forth and says, well, actually, we're energetic beings, and the physical is secondary to that, there's a conflict. It's kind of like maybe a simple way to understand. It's kind of like the argument between the religious person and the atheist.
Right.
You know,
Yep.
they argue with each other. They interpret things differently. They won't accept each other's beliefs. It's the same thing in medicine. You know, that the idea that there's a life force is pretty much rejected by conventional medicine.
That's true.
Not by every individual, but by medicine. So from the beginning, when we say there is a life force and that idea is rejected outright, and then you say, well, the medicines that we use have an energy in them, that's rejected as well.
Sure.
So what's left for most people is, well, there's nothing to it.
Yep.
You see.
Yeah, and that makes sense in terms of people discounting it. If they can't accept the premise that there's energy involved, they're just done with it completely. So that
and you know, Karen, an interesting thing is that nonetheless, in veterinary medicine, there's been quite a wide acceptance of Chinese medicine.
Right.
And Chinese medicine has the same idea that there's an energy they call qi. It's not physical.
Right.
That circulates through the meridians, and you can direct that energy with needles. So strangely enough, veterinarians have accepted the idea of energy like that, but they reject the idea from homeopathy.
Well, and I think part of it will be proven with quantum physics, where I think, at least for me initially, it was the whole dilution aspect, that how can something that just has a vibrational imprint, there's not even medicine there, how can it affect the body? And I had a similar experience. Even before I was a veterinarian, I was a wildlife rehabilitator, and I worked with a rehabilitator that used homeopathy, classical homeopathy exclusively, and she had fantastic results. So I didn't even care how it worked. I just saw this tremendous improvement with wild animals using homeopathy, and I was a believer based on proof. So I saw testings occur, and it was all I needed. Yeah. Sometimes when you go through formal training to be a veterinarian, of course, you start questioning, well, there's no active medicine there, and then that's when it comes down to, because I do feel strongly about the spiritual aspects of medicine, so homeopathy was a natural progression for me in my practice and my evolution as a doctor. But that's not necessarily true of all doctors. Richard, what do you, when people ask about research pertaining to homeopathy, and a lot of people, a lot of critics will say there's just no research out there, what do you say to people who have questions about that?
Well, it's not accurate to say there's no research. There certainly is research. It's like, let me think a minute. The research that what people mean by the word research when they talk about medical research is based on the conventional allopathic system.
Yes.
And that is that, let's say that we're studying a drug that's used to treat the common cold, all right? So you take a group of people together and you've given them all the same diagnosis, that they have a cold, all right? And group them together, and then we test that drug on all those people. So the treatment is based on the diagnosis, right?
Yep.
And they're all given the same medicine. Mm-hmm. Now, if we go over to the homeopathic model, one of the things that was learned early on is that not everybody with a cold has the same pattern. Some people have a stuffed up nose, some have a very runny nose, some have a lot of sneezing, some also have swollen tonsils, some have headaches, and so they don't all require the same homeopathic medicine. We match the homeopathic, there might be 50 medicines that could be used for a cold, so we pick the one that fits that particular patient.
Right.
You can see that doesn't fit into the same model of testing.
Right.
So usually what has been done as far as research in homeopathy is kind of a hybrid model, if you will. They'll take for example, one study I presented in the course, if you remember, was done with people that have had arthritis. Mm-hmm. And so they grouped people together with that diagnosis, and then they had 2 or 3 of the most common remedies used for that problem in homeopathy that they gave to these people. And they got better. They were able to show statistically an improvement as good or better than it is with conventional drugs. So that was demonstrated that the homeopathy worked. It just wasn't the kind of study that we would do in homeopathy if we had our way with it. Does that make sense?
Sure, of course. Because
it's based on a different model.
A totally different model. And so then that brings me to another question. Certainly, very trendy now is to put not all of the remedies for arthritis, but to use combination to in one pill, put 5 or 6 different homeopathic remedies and label it the arthritis homeopathic or the allergy homeopathic.
Right.
Talk to me. I know why that's not in a patient's best interest, but talk to me and talk to our listeners about why you would not recommend throwing the kitchen sink with every possible remedy, and why you would discourage against people doing that.
Should I be brutally honest?
Yes, you should. You should be brutally honest.
All right, let's go back to this, what I gave you as a model of the common cold. All right?
Yep.
So the practitioner that's going to treat people, the homeopathic practitioner, has studied over a period of time as part of their discipline. They've studied these medicines. They know them, right? So you come in with a certain kind of cold, and if I were that practitioner, I could say, okay, here's the medicine you need. This is a specific one you need.
Right.
I wouldn't give you more than one, because it's known that that it's very possible if you give other ones, they counteract each other. They
Right.
interfere with each other.
Yep.
So I'm going to pick the one that's appropriate, and you'll have a very nice, fast response to that. I'll give you a little example, if we have time for
Yes,
that.
please.
I was a few years ago, I had finished a seminar up in Utah, Park City, Utah. And we were checking out of the hotel there where the meeting was. It was over. We were checking out. I was at the counter, and one of the veterinarians that was in the class there was checking out next to me. And she was sort of, I don't remember the details, sniffling or something. And I said, what's going on? And are you not well? And she said, oh, I think I'm coming down with this cold. And he explained a little bit to me, and I said, well, it sounds to me like it's this remedy. Do you have it with you? Yes, she does, she says. And she pulls it out of her suitcase or whatever, and takes the remedy. And before we got down through the shuttle, she felt completely well,
Yeah.
you see.
Yes.
So it can be very rapid. Now,
if the remedy is selected correctly, yes.
it has to be selected correctly.
Yes.
If it's not the right choice, it won't do anything,
Yes.
or it might even sort of make you feel not so well for a while.
Correct.
Okay.
Yeah.
Now, that's how the practitioner, that's the knowledge and skill of the practitioner.
Right.
All right. What if you don't have that knowledge and skill? Okay. You don't want to study, or you haven't studied. So you say to yourself, I'm just making this person up.
Yep.
Or you could say it's a pharmacist, or it's a homeopath, or whatever. Well, I don't know which of these 30 medicines would be best to treat the cold, but let me take the top 6 or the
Right.
top 8 and mix them together.
Right.
Maybe one of those will work.
Right. And it's a perfect analogy. That's exactly what people are doing. And it's
Yes.
concerning, very concerning.
So it's a very low level of skill. It's kind of like if you went to a doctor and the doctor didn't know enough as to what antibiotic to treat for your infection, so he mixes 6 of them together
Yep.
and gives them to you.
Just take them all, right?
Take them all. Maybe one of them will work.
One of them should work, we hope. Right. But by default, then, of course, you can suppress, and things come out later at a much deeper, more pathologic magnitude. And I think that's the aspect that a lot of
Yes.
people don't realize.
Well, oftentimes, what we're talking about here is the difference between, in homeopathy, we divide it into acute and chronic diseases. An acute disease would be like a cold or like an injury, and it's going to only last a certain amount of time and then you recover. There are certain conditions that are what we call chronic conditions, and that's more like we know like as allergies and hyperthyroid cats,
Yep.
arthritis, things like that, if they're treated as we're talking about with these multiple remedies, can actually make the animal less curable.
Right.
Because it covers up some of the symptoms, pushes them in a different direction, actually can make the whole thing more complicated.
Well, and that's a lot of people will say, well, it can't hurt. It's homeopathic; it can't hurt. And I know that was one of the things that you so wisely cautioned us against in our training, was that you do need to be responsible in the decision-making process in terms of making sure you feel confident with the perfect or as close to perfect remedy as you can select for your patient, because having it be almost or close enough, oftentimes you can end up not honoring that oath of above all do no harm. You can inadvertently suppress, and I think that people don't realize, they assume homeopathy would never in any way be, when I say harmful, that it would not do anything. At best it would do nothing, and at worst it would do nothing, and at best you might get some improvement. But with some of these combination homeopathics, you do have other concerns, as well as injectable homeopathics. That's something that was never studied 200 years ago by Dr. Hahnemann, correct?
Right. No, it wasn't. And he recommended that it be given by mouth because that was the most effective way of administering it. He did talk about rubbing it on the skin in some cases, but we don't need to go there.
Right.
But, basically, no, it should be given by mouth.
Right.
And there's no reason to inject it. In fact, it doesn't even work as well to inject it. So remedies are given, single remedies are given at a time. That's the way homeopathy is done. Mm-hmm. And what you talked about with suppression, a lot of people don't understand what that means, but it probably makes more sense if we say, if your animal has say arthritis, and we use a corticosteroid to make the symptoms go away, but the arthritis is not cured. That's what we mean by suppression.
Yes.
And the same thing can happen with homeopathy. You can use these remedies over and over again, and you can make symptoms go away, but you haven't restored their health because it's not the right remedy.
And that's such an important point to make, such an important point, and I appreciate you clarifying that. I appreciate all that you have done over your magnificent career. I appreciate you being a mentor and a leader in our field. All of the training courses that you put together and that you've developed have been life-changing for many of us holistic veterinarians, but it really has opened up the field of veterinary homeopathy in a way that would not have been done if you had not been so passionate about promoting this ability for natural healing to occur. So I admire what you're doing and what you have done and what you continue to do. It's been an honor having you here, and I appreciate you taking the time to talk with us today.
Well, thank you very much. I love the word magnificent.
Well, that's you, Dr. Pitcairn. We appreciate everything that you do. We really do.
Yeah, well, thank you. Thank you.